and seen medical care from the patient's perspective. I was the other side of the equation, and I saw so many injustice, indifference, lack of care. So many times that I had to wait for a physician to talk to me, for a nurse to take me to the room. So many hours and moments of seeing people that they don't care, they're not kind and compassionate. There was no smile. People who were more concerned about lunchtime and 10 minutes of their break before they see you and take care of you. But at the same time, I also witnessed so many health professionals with sparks of compassion and kindness. And now that it's been 6 months that he's completely healed, the only memory that it stays with me is those experiences of those people that helped me and my family through those dark days, those moments of hopelessness and pain. So medical field and profession is a platform that gives you a meaning and purpose. It has a deep value, and it's all involved with the mastery. All of you guys are professional. It brings relationship and teamwork. It's all about giving, altruism. It's about being and going beyond and above yourself, healing and taking care of other people. It's a platform that brings you every day positive emotions of gratitude, hope, and it's involved a lot of challenges, daily challenges with patients' problems and family problems. And those challenges make us human. When we get involved and engage and we conquer those problems, we achieve something, we're proud of it ourselves. It gives you contentment, a feeling of pride. And also it involves a lot of relationships between yourself and you and the patients. And to me, the most important thing is gives us a meaning for life. And that combination, it brings you the zest and energy back. It gives you something to work with every day. So, patient health professional experience is about compassion, kindness, care, and connection. And those are four foundations, those are virtues of humanity that we lost in this very complex healthcare. And each of us responsible to rely on those in order to bring back and restore the humanity in our care. Compassion is the essence of humanity. It's the reason we survive. Compassion means perspective taking, understanding other people's feeling and pain and suffering, putting ourselves in their shoes and feeling the same way they feel, and actively trying to help them to alleviate their problems. And all of us born with compassion. Compassion is part of our brain circuits. It's inside of us. But society and culture of indifference basically dampen that compassion. And we are responsible to activate that and cultivate that in order to improve our experience in daily life. And care, in my opinion, is opposite of indifference. It's sensitivity to things around us, the things that happen to us and our friends and colleagues and our patients. And not just staying quiet, checking in, being passionate and engaged. That's what the care means. And the kindness, as Mark Twain says, is a language. It's a language that deaf can hear and blind can see. It ties everything together. You can be compassionate and caring, but if you're not kind and they don't see your smile and they feel that you don't do it from your heart, it doesn't work. And it's all about connection. And the connection doesn't mean that we have to sit down with people and talk about their life for 2 hours. It's just that minute that you go, and the spark, the first spark. It's like a love in the first sight. And you can create that connection, a deep connection. Because at the end, if anything wants to happen, those relationships, you need to create the trust. The trust is that safety zone, that you are free. You try to fly. You try to create those authentic connection and practice the virtues of humanity, which is compassion, kindness, and care. When we talk about experiences, right? What is the experience? Experience is what we perceive and understand and memorize from an event, right? That's in the dictionary. But it's, most of the time, any experience comes with some sort of an emotion. So we all know what happens when we perceive and understand and memorize things. What happens in our brain? These are all bioelectrical things that happens in our mind and brain that create that memory and experience. But nobody knows why these events has created emotion within us. You know, the emotion of love and hate and sadness. And nobody knows what happens in our brain and mind. But it's true, right? Everybody has that. And a lot of these experiences, they stay with us and link with that emotion. So sometimes when you memorize and you remember that memory, it brings back that emotion also. Like the first kiss, right? Or the first time you see your child when they're born. So these emotions are sometimes, there are negative emotions and we have positive emotions. And the negative emotions are anger and frustration and fear. Those are the negative emotions. The negative emotions are not that bad. They actually, we need them, negative emotions. They're lifesavers at times. They saved us. They narrowed our perspective to focus on the problems and things that happens around us so we can save our lives, right? So it's not always bad. And positive emotions they're not lifesavers. They're like a tiny little reward system in our mind. They helped us to do things, to motivate us to do the right thing. It's hope, love, inspiration, awe. Those are the positive emotions. Positive emotions broaden our spectrum to life and let us to see the beauty of life, right? The gratitude. And in our profession, when you create that safety zone of trust and create that authentic connection with your patients and practice the compassion and care and kindness, something magical will happen. And again, a lot of times we don't even see they telling us anything. But when you look at their faces and faces of their family, you see their gratitude and hope. And that emotion and experience actually transfers into you with that connection as a sense of pride and humility. And those are the things that happens every day if you really pay attention to it. So these positive emotions, as Barbara Fredrickson, who is a researcher, says, it also changes your character. It creates a character within you. You know, when I was a medical student, they said brain is the only place that the nerves, they don't regenerate. But it's completely wrong. The nerve is constantly changing. The circuits in our brain constantly changing. And just like practicing to play music, and after a while you can learn how to play music or how to drive or swim, it's the same thing. When you play the compassion and kindness, after a while it activates those circuits, and those nerves and axons, they fire together, they wire together and create a different character within you. And what happens is that it makes you to be the best version of yourself. And that's what's called well-being. To try to flourish, to be the best of yourself. And then if every one of us to do this, then you have the change in our culture, the culture of the workplace. And culture is everything. Because when other new people come into that culture, they actually follow the same pathway. So I came up with this ritual. So for a lot of people, these rituals are very funny, right? It's not one of those rituals that you go to church every Sunday. This is ritual that we have to do every day for ourselves, so we don't get burned out after a while and get frustrated. And this ritual doesn't need you to light on a candle and sit down and do this. It's just when you drive in the morning to work, or when you go home, before you go home and open the door and enter your normal life, just few moments of reflection. And remembering the daily rule of treating people like your family, like a family member, and practicing the essence of humanity, the kindness, the compassion, the care, and try to connect with people. And in our practice, the most important thing for patients when they come in to the hospital, because they don't know us and they don't trust us, is to know them, to understand their problems and their plans, and what we need to do to take care of them. They need to feel comfortable that we are on top of things. And in order to do that, you need to round with the patient's doctor, and update the family, and these things that needs to happen in a daily basis, every moment. And create a connection, again, is not about you going in and sitting down and spending 2 hours of time. It's just 1 minute. When you go there, you just have to be there. That one moment. Be attentive. Attention, and I tried that so many times over the last 3 years. I used to remember when I was at home, I had this obsession to watch this Lakers game. So I used to record it and come home, and I had to watch that Lakers game. So my wife comes in, and then she's talking to me, and I'm looking at this Lakers game, and I'm talking to her like this. Right? That doesn't create the connection. So we do the same thing with our patient most of the time, because we go into the room and start a communication and talking, but our mind is other places, is my lunch time, or my break time, or the nurse didn't do their job, the other one, and I have to do his job or her job. But being there, just 1 minute, communicate and listen, listen, and just be attentive. Quicker response to patients, most of the time what we call is, this is a difficult patient, right? So many times they beep, and we say, this is a difficult patient. But I tell you, I had that experience last year. It's so hard as a patient. It is so hard. Every moment that I was waiting for a physician to come out and talk to me about my son in the operating room, I was in the waiting room. Those moments was hours and days. Every time I was in the room waiting for the physician to come in and talk to me about the surgery, even though I was a surgeon and I knew everything about the operation, but I felt so uncomfortable. Those minutes lasted hours, and 1.5 hours that I was waited for a physician to come to the room to talk to me about my surgery, my son's surgery, it was days. So when they ask you, they're cold, and they want